Hello and welcome to American Stories. I'm Saida Pagan. Our guest today is Katie Boateng. She is president of the Smell and Taste Association of North America, and she's here today to talk about a wider movement, the movement that is called Toward Universal Chemosensory Testing. Welcome to our program, Katie.
Thank you for having me. I'm excited to be here today.
Tell us about your role in this movement.
So, I'm involved in the movement in several different ways. In my personal capacity as a person who has acquired anosmia due to an upper respiratory infection, it's very important to me that we move towards a world that has universal chemosensory testing for everyone. And then also in my role as president and a founding board member of STANA, or the Smell and Taste Association of North America. We advocate as an organization for a world where your taste and smell are valued as essential to health, safety, and wellness, and screening those are a key part of that.
Now, tell us about how you are personally involved in this movement. Are you meeting? Are you communicating? Are you advocating? Tell us about that.
Yeah, so there was actually a conference held in November of 2018 called Toward Universal Chemosensory Testing that was co-hosted by Monell and other organizations, the Monell Chemical Senses Center in Philadelphia. And I attended that as an individual. At that conference, I was able to meet people who had anosmia for the first time in my life, and it was an amazing experience to get connected with others who just understood innately what I was going through and all that that entails. So at that conference, the need for a patient advocacy organization in the United States was identified, and the seeds for what became STANA were planted there. So in my capacity now, and since then, STANA and myself, we have met regularly with chemosensory institutions, smell and taste clinics that are around the country to have conversations about the need for baseline testing for smell and taste, or as they're called, chemosensory, the chemosenses, so chemosensory testing. So I have glasses. A lot of people wear glasses. You would not go to the doctor and tell them, I can't see, I'm experiencing blindness, and be sent away with no tests. That would never happen in today's day and age. But that's what happens often for people who are experiencing smell and taste dysfunction. I lost my sense of smell in 2009, and I was not given an objective smell test. So, one where they actually had me do like a scratch and sniff of any sort until I went to that TUCT conference, the Toward Universal Chemosensory Testing Conference in 2018. So, 9 years. The doctors all believed me that I couldn't smell, so they took my word for it, but I was never tested, and that's unacceptable.
Tell us about the circumstances that surround you, in particular, losing your sense of smell.
Yeah, so in my first year of college, I was very ill over winter break, that break between fall and spring semesters, and I just did not feel well. I had like a lingering sickness and upper respiratory infection. And during the time that I was actively sick, I realized I couldn't smell or I couldn't really taste my food. Everybody knows that happens when you fall sick, right? You're stuffy, you're not really enjoying the food, those types of things. But what I didn't realize until spring was that I still couldn't smell anything. So I was better. I was over the illness. But I was sitting at my breakfast table one day and I was eating something, and one of my roommates, college housing, I lived with like five other people at the time. She was cleaning the table with like bleach cleaning spray. And I thought to myself, wait a second, what's in that bottle of cleaning spray? Is that just like water, or is that actually like Clorox? Like, what has she got in there? Because I can't smell it. And I asked her, and she told me that it was like Clorox spray, and that has a very distinctive smell. And so I was kind of scared at that moment, a little bit worried. Um, Maybe there's something going on with my nose still because I had been so sick. So I went around the apartment, I was sniffing in the trash can, I was opening up like very concerning Tupperware in the fridge that had probably been there for a really long time, and I couldn't smell anything. And so I was very concerned. at that point. And the next time that I went home to my hometown, which was about an hour and a half away from my college town, to our family doctor, I had brought it up and started my medical journey to try and get diagnosed and figure out what was going on with my sense of smell because I was physically better, but I couldn't smell anymore.
What was that like? What was it like for you to not be able to smell anything psychologically? What went through your mind? How did things change at that point?
It was really hard, I think, because when you as a person go to a doctor, you're expecting for them to know what's going on or to figure out what's going on for you or with you. And so to go through my medical journey, which was a primary care provider, then an ear, nose, and throat specialist, then a neurologist, and be told at every point that they're not sure why I can't smell. Best guess is that it's probably my olfactory nerves were damaged and good luck with your life, basically. Like that was rough. So I was hoping that someone, anyone would have information for me. Like, what does this mean for my life? Is it going to come back? How is this going to affect me? And I figured that out little by little over the years of just how many quality of life issues there are without a sense of smell. Highest safety, like gas, food safety, but also really important things like your mood and your mental health can really suffer if you're experiencing a smell or taste disorder. Um, so all of those things were not addressed. And so I think at the time, I just felt very isolated and very scared because there was no information for me. And honestly, that's part of how later um, in life I became more of a patient advocate and was so inspired to work and start STANA because no one should have to have that experience. There should be information, there should be resources available for people so that they know that they're not alone.
Since then, I'm assuming that was 10 plus years ago. Have you gone to other doctors? Have you tried, I don't know, over the counter or anecdotal sorts of ways of dealing with it? Tell us about that. I know you went to medical doctors, but I'm sure people have given you advice or try this, try that.
Yeah. So I have a 4-year-old and he is just really starting, he's almost 5, and he's really starting to understand more things. And so we talk with him about like he doesn't know how to do things yet. And so what's really funny is that he will tell me to just really try harder with my smelling because I've explained to him that I don't have the ability to smell or that I can't smell something. And so he'll say, like, well, you just need to try harder and you'll get it eventually. So he's not quite understanding that I don't have a sense of smell, but there's so many like homeopathic remedies out there on the internet, and I'm sure some of them are credible, most of them are not. Um, I have tried olfactory training. I think that it is most effective for people who have certain types of smell dysfunction or who have recent smell dysfunction. So if someone had told me about that in 2009, 2010, I feel like that would have been more effective for me. At this point in my journey, it's like 16 plus years later. I don't know that smell training is going to be effective for me, so I don't actively pursue that anymore. I'm not saying that it wouldn't be. There are like stories out there that people have attempted that much later and that has helped them, which is amazing. I just think that the emotional bandwidth to keep trying that, I lack. So for me, it is a lot of like you have to sit there and focus, pay attention, really try. And there's this banter in your head of maybe you're just not trying hard enough or this is pointless because it's not going to work for me. So I don't have like the emotional capacity to do that on a daily basis right now. Maybe I'll revisit that again in the future, but there are great things about smell training for some people.
Every morning when you wake up, do you think maybe today is the day that it'll come back?
No, I don't. No, I don't anymore.
Was there a point
Whole,
when you did?
yeah, I think in the beginning years I did. I thought like it would come back eventually. For quite a while, I just didn't look at it. I didn't think about it. I describe it as I took having anosmia and I packaged it into like a little box. And then I tied that up really tight and like wrapped it in a bunch of bows. And then I just shoved that in the back of a closet under a bunch of clothes. And I did not look at it for years. Like, and you can say, how can you possibly do that? Go throughout your day not having a sense of smell and like not pay attention to it. But denial is powerful. And I just didn't really address it. I didn't think about it too much. There were other aspects of my life that definitely suffered, like mental health, emotional health, like depression, anxiety. I was like, oh, I'm feeling anxious. I'm feeling depressed. But I wasn't identifying the elephant in the room of the anosmia and how that was so closely tied um, until I moved to New Jersey and I had some time on my hands while I was hunting for jobs. So this was 2018. My husband and I moved from Idaho, where I'm from, to New Jersey, and I was job hunting. I had a couple of months where I was looking for work. And during that time, I started the Smell podcast. I'm not actively interviewing for that anymore, but I do have over 100 different interviews with people. And it really was a resource for me, but it ended up helping so many people. And the point of the podcast was so that people could hear each other's stories and know that they're not alone, so that they didn't feel like I did before I went to that tucked conference.
Is there a circle of individuals that you know that have the same issue, the anosmia, that you communicate with? Is there that kind of a support group or a community of those who have lost their sense of smell or have a diminished sense of smell?
Yeah, so there are definitely people that I've connected with over the years via social media or having met them in person. One of my very close colleagues at STANA, she also has acquired anosmia, very similar time frame to me, so we'll talk about it at times together. I'm at a place in my own journey where it doesn't necessarily define me as much as it did previously. So I think it ebbs and flows for me with the amount of support that I need. So in the beginning, that would have been like really key for me to have those people around me. But now in my life, I feel like I'm more okay. Like I don't necessarily I'm still affected by it, but it's not as like close anymore, if that makes sense.
Um, what about your own family? I know that I have spoken with other individuals who have lost their sense of smell, and a lot of times they tell me little things like the food that they cook is tasted by their family first, and they tell them it needs this or it doesn't need this, or how does it taste at all, or that kind of thing, or smell or whatever. Or so what is, what kind of support system do you have, or what kind of circle of friends and family do you have that can help you along your journey?
Yeah, so I'm married. My husband will help me all the time with smelling different types of food. I actively label everything that I make with a date so that I know when I made it. He actually does that too, with the foods that he makes. I cook as a function, so I like to bake, like more I enjoy baking because I think that's like relaxing and things like that. But as far as like cooking daily for my family, I feel like I do that because everyone needs to eat, but it's not something that I necessarily enjoy. But my husband is around to like help me like do the sniff test for certain foods and to just make sure that it's okay. I can also look, like I can see if something looks bad. I won't have myself or the kids eat it. Like lunch meat will get like a weird sheen on it. Like I just won't touch it. So I'm sure that I waste more food than is probably necessary, especially if my husband's gone and I don't have him to ask.
And that helps. If you would lived alone, what would that be like? I mean, I'm sure a lot of people who've lost their sense of smell do live alone, and that can be, I would think, a little bit difficult, perhaps a little bit dangerous. Could you speak to that, even though that's not your personal situation?
Oh, it's for sure dangerous. There's been moments where he's not here. like he's working or traveling, and things have happened. So when my first son was born, um, we were in New Jersey. I was home with him on maternity leave, and I was boiling like the bottle nipples on the stove. And then me and the baby were like in the living room watching TV, just hanging out, relaxing while he was napping and stuff. And the fire alarm goes off, and I look over, and the pot that I had the nipples boiling in, all the water had boiled off, and the plastic had like melted, and it was all kind of like black charcoal mess, smoke. And I was like, oh geez. And that was really close to me. That was, I don't know, 50 feet away. But I was just like angled that I didn't see it. And I didn't have the smell cue to tell me that the water's gone, the nipples are burning, like this, go take care of that. So it is very dangerous. It can be very dangerous. Another example, Stephen was gone for a work trip, and at like 3 in the morning, the fire alarm goes off in our house here. And I was so stressed that night because I went around to literally like every nook and cranny of this house looking for fire. And it was like a false alarm, I guess. And the company called, and we said, there's no fire here that I can see. And the woman asked me on the phone, well, do you smell smoke? And I said, well, I can't smell, so no, but I don't see anything. Like I've been looking around, and so it was just not a great night after that. Like this is like 3 in the morning. So I did not sleep because I was so worried that the attic was on fire, or like I missed it somewhere. Maybe there was like something on fire in a garbage can. Like it was very stressful. So I can imagine that people who live by themselves are very concerned about this. Gas, I know gas is a huge concern for people. Like we have a gas stove, and they add, I think it's mercaptan to that to make it smell so people can be alerted when it's leaking. Again, no, there's no cue there for people who have anosmia. And so there's been a couple of close calls for people that I've spoken to with gas in their home because they can't alert to that in the normal way.
Yes, interesting and very very real stories that you're telling us about that. Tell us now, let's talk about your association, what you do, what you advocate for, and then I'd like to talk about what else you feel it needs to be done in America or worldwide with this. So, what does your organization do?
Yeah, so STANA is the Smell and Taste Association of North America, and we exist to advocate for a world where, like I mentioned before, smell and taste are valued as essential to our health, safety, and wellness because they are. And currently, we don't take these senses or their loss very seriously unless it directly affects us. So a lot of people don't understand the gravity of what it is like to live with these without these senses, and it doesn't click for them all the time. Um, for example, my sister-in-law shared with me before that um, someone in her family passed away, and the smell of their cologne gives her a lot of comfort. And she had expressed to me, I can't imagine, like that is the moment for her that it clicked for her what my life is like. I can't imagine not being able to smell that cologne to bring back memories and things like that. So we're here to spread the word about how important smell and taste are. Smell is very forgotten, taste maybe even more so. There are smell tests that exist out there in the world. There are taste tests as well, but they're a lot more difficult to administer. So as far as smell needs to go, taste needs to go even further. But we're here to provide support to patients who get in touch with us, resources, information. We're really big on trying to connect people with like good evidence-based information on things that they can try or that they can go speak to a rhinologist about, because it is kind of hard to navigate all of the information online and on social media. People will say, well, just burn an orange and that will help you. I don't know if you remember that one, but during COVID, people were saying you could burn an orange and that would fix your sense of smell. Um, there's no evidence for that. So just things like that of just really trying to provide good quality information to people. Another thing that STANA is currently focused on is our patient partner cohort. So we have a group of individuals who have lived experience with smell and taste dysfunction, and we have trained them on how to be partners in the research process. So this is not training them on how to be a part of a research study, not about being like a trial participant. We have trained these people on how to work with the researchers and the clinicians to create the study together so that the patient perspectives are included and incorporated throughout every step of the process because that makes the trial or the study better. So we're really focusing on our PPC, as we call it, and scaling that, expanding that. Um, and we're really excited for that work.
Do you advocate for more research?
Yes. Wherever possible, we do advocate for additional research, especially for um, people with certain conditions related to losing the sense of smell. For example, like acquired anosmia has very little research. But then to add on to that, like people who have a congenital anosmia, there's even like a smaller percentage of um, research dollars or hours that are dedicated to looking into any type of like cochlear implant for the nose. I don't even know what you would call that. Obviously, it wouldn't be a cochlear implant, but that kind of thing. It doesn't really exist. So yes, we advocate for additional research for all types of anosmia.
I did a story a few years ago about the robotic nose. I don't know if you heard about that. They
Oh, that's
were,
awesome.
yeah, they were working on it, but it's years and years away. So yes, research. So what needs to change in the American, let's start with America, the American medical system and the norms, the guidelines, which at this point I've never been tested for any of that. And I
No.
know most people have not. So what needs to change?
I think the first and most important thing would be to make the case that preventative screening for smell and taste are valuable and that they save money down the line. So a lot of insurance companies and like the AMA, they don't have any kind of CPT. I think it's called CPT or like ICD-10 codes for preventative smell or taste testing. So I know that there are some insurance codes, maybe if you're experiencing smell dysfunction, but as far as preventative codes, I don't believe that those exist. So in a perfect world, we would create those codes so that they could be reimbursed by insurance companies because doctors are not going to give an exam to someone if it's not paid for by insurance. Maybe if they're very generous and kind, they would do that, but their office would have to pay for that. And so that I think is the biggest thing that needs to change in the American healthcare system is the establishment of the codes that would make these tests reimbursable by insurance.
What about training? What about medical training so that the medical staff is aware, just greater awareness? I know it's very difficult for doctors. I would think they have to study this, that, and the other thing, and then
Yes.
now this, but it's important, of course. So, what about just greater awareness and training?
Yeah, I think that it would be important to include additional information about the effects of smell dysfunction on all areas of a person's life for medical staff so that they could know. And again, to make the case that it's important information because, especially for like dementia or neurodegenerative disorders, the dementia, Alzheimer's, Parkinson's disease, smell is a huge indicator, even decades in advance. So if there's something going on with smell, and we are tracking that information, we could potentially identify people who are going to experience these serious conditions well in advance. And although you may not be able to prevent it, you could improve their quality of life. You could identify it a lot sooner and make a plan. So I think making the healthcare workers aware of that and why we're asking them to screen would be helpful.
And just one more time, explain your role in the toward universal chemosensory testing movement. What exactly is your role or the role of your organization?
So STANA advocates for universal chemosensory testing whenever we can. So making the case for why it's important, why it matters. We are involved with other chemosensory smell and taste centers, research institutes, all to kind of drive this message forward in all the different areas that we can, that this is important and this is what's needed. Ultimately, I think long term, the goal would be to advocate for these types of things on like Capitol Hill, eventually, and to really get like a nationwide movement going for why we need the universal chemosensory testing, like vision or even hearing. My children were all tested for hearing before they even left the hospital. So just continuing as an organization and as an individual to talk about why it matters and how we could potentially get there is what we do.
What smells do you miss the most? Food,
I think for
flowers?
me, actually, it's been so long. I think there's a specific lotion and like perfume that my mom has. It's called Summer Hill by Crabtree and Evelyn, and they don't even make it anymore. It's like a limited edition one. So like every once in a while they'll make the hand creams. But I can remember that one. That's something that I miss because it's so it's like a visceral smell for me. It reminds me of my mom. And then I would say probably like a close second is like the smell of Christmas dinner. That's a very nuanced answer, but like ham and spices and like potatoes and like that, those types of smells, I think, are the ones that I miss the most.
Do you think in your lifetime you might regain your sense of smell?
I'm hopeful. Yeah, I mean, I'm not completely hopeless. So I think that there's improvements and treatments being studied. And eventually we're going to get to a point where maybe there is like a cochlear implant for the nose, whatever that looks like, or something that we could help people recover their sense of smell. I know that I honestly think it would be overwhelming. And I've heard that from other people with anosmia that we would like it if it could like do a volume level, but for smell. So you like turn it up, turn it down, if it becomes too overwhelming, like sensory wise. So, but I'm hopeful. I hope so.
Well, thank you for the work that you're doing. I know that there are a lot of people out there, not just in America, but worldwide, who are very appreciative of your efforts.
Thank you. Thank you for having me on today.
And thank you for joining us for this edition of American Stories. I'm Saida Pagan.